Learning objectives: to describe the position and shape of axilla, to discuss the boundaries of axilla, to discuss the formation, course, and relations of axillary vessels, describe the arrangement and groups of axillary lymph nodes. So, starting with axilla. Axilla is a region which lies underneath the glenohumeral joint, that is the shoulder joint, at the junction of the upper limb and the thorax. It is formed by three bones, that is the clavicle, the scapula, and the humerus. In addition to it, the upper thoracic walls and the related muscles. All these structures form the axilla. The axilla is an irregularly shaped pyramidal space with four sides, an inlet, and a floor or a base. Starting with axillary inlet. The axillary inlet or apex is continuous superiorly with the neck region, and the lateral part of the floor opens into the arm. The axillary inlet is somehow triangular in shape. The margins of the inlet are completely formed by the bones. The medial margin is the lateral border of the rib 1. Now you can see the medial margin of the axillary inlet, which is formed by the first rib. This is the first rib, this is the medial border of the first rib, and this would be the lateral border of the first rib. The lateral border of the first rib forms the medial border of the axillary inlet. The anterior margin is the posterior surface of the clavicle. This is the anterior margin of the axillary inlet, which is actually the posterior surface of the clavicle. This is the anterior surface of the clavicle, and this is the posterior surface of the clavicle, which forms the anterior margin of the axillary inlet. The medial border or the medial margin of the axillary inlet is formed by the lateral border of the rib 1, whereas the anterior margin is formed by the posterior surface of the clavicle. The posterior margin is the superior border of the scapula. This is the scapula. The posterior margin is formed by the superior border of the axilla, or the axillary inlet. So these are the three boundaries of the axillary inlet, which is formed by three specific bones. The medial one is formed by the rib 1, that is the lower border, that is the lateral border of rib 1, whereas the anterior margin is formed by the posterior surface of the clavicle, and the posterior margin is formed by the superior border of the scapula. The apex of the triangularly shaped axillary inlet is somehow lateral in position, formed by the medial aspect of the coracoid process. Major vessels and nerves pass through the pass between the neck and the axilla by crossing over the lateral border of rib 1 and through the axillary inlet. The subclavian artery, if you could see in the picture, the subclavian artery, this is the subclavian artery, which is the major blood supply of the neck. As it passes through the first rib, this is the first rib, as it passes through the first rib, it becomes the axillary artery. Similarly, the subclavian vein, this is the subclavian vein, as it crosses the first rib, it becomes the axillary vein. At the axillary inlet, the axillary vein is anterior to the axillary artery. So this is the axillary inlet. This is the axillary inlet which we have discussed before, is a triangular structure, and at this structure you could see that the axillary artery, this red one is the axillary artery and this one is the axillary vein. The axillary vein lies anterior to the axillary artery, and the axillary artery is anterior to the brachial plexus. These are the brachial plexus. So the most anterior would be the axillary vein, then comes the axillary artery, and finally the brachial plexus. But as they pass over the rib 1, the vein and artery are separated by the insertion of the anterior scalene muscle. So you can see, you have seen before that the vein is anterior to the artery, but as they pass over the rib 1, this is the rib 1, the insertion of the anterior scalene muscle lies between the vein and the artery. So the lateral wall, as we have discussed before, that the axilla is a four-sided pyramid-shaped structure, four-sided structure having a base and an apex. The apex or the axillary inlet, we have discussed it, that it is a bony structure. It is somewhat triangular in shape, formed by three bones, that is the medial border is formed by the lateral border of rib 1, the anterior surface is formed by the posterior surface of the clavicle, and the posterior surface is formed by the superior border of the scapula. Now coming to the lateral wall of the axilla, the lateral wall of the axilla is formed by the intertubercular groove of the humerus. The medial wall of the axilla, this is the medial wall of the axilla, is formed by the serratus anterior muscle and the thoracic wall, ribs and the intercostal muscle. The anterior wall is formed by the three muscles of the pectoral region, that is the pectoralis major, the pectoralis minor, and the subclavius muscle. We have discussed all these three muscles in detail in our previous lecture of pectoral region. And the posterior wall of the axilla is formed by the subscapularis muscle, the teres major muscle, and the latissimus dorsi. So these are the four sides of the axilla, that is the anterior wall, which are formed by the three muscles of the pectoral region, that is the pectoralis major, minor, and the subclavius. Then comes the lateral wall, which is formed by the intertubercular groove of the humerus. Then we have the medial wall of the axilla, which is formed by the serratus anterior muscle and the thoracic wall, and finally the posterior muscle posterior wall, which is formed by the subscapularis muscle, teres major, and the latissimus dorsi. Then we have several gateways or passages in the posterior wall. These are the quadrangular space, the triangular interval, and the triangular space. So starting with the quadrangular space. The quadrangular space, as the name suggests, it is a four-sided bounded structure which is formed by the surgical neck of the humerus on the lateral side. Then we have the superior boundary is formed by the teres minor muscle. You can see in the picture that the superior margin is formed by the teres minor muscle, the inferior margin is formed by the teres major muscle, and most medially would be the long head of triceps brachii. So this would be the quadrangular space, which is a four-sided structure. The superiorly would be the teres minor, inferiorly would be the teres major, laterally would be the surgical neck of the humerus, and medially would be the long head of triceps brachii. Axillary nerve and posterior humeral circumflex artery are the contents of the quadrangular space. Then we have triangular space. This is a triangular space, a three-sided structure which is formed by the medial margin of the long head of triceps. This is the triceps. Then we have the superior margin of teres major. This is the superior margin of the teres major, and the inferior margin of the subscapularis muscle. This is the inferior margin of the subscapularis muscle. So these three muscles will form the triangular space, which is a three-sided bounded structure. That is, the three muscles would be the long head of the triceps. This is the long head of the triceps. Inferiorly would be teres major, and other muscle would be the inferior margin of the subscapularis. This is the subscapularis muscle, and inferior margin of the subscapularis muscle would form the triangular space. The content of the triangular space would be scapular circumflex artery. Then we have triangular interval. Triangular interval, this is the triangular interval. It is formed by the lateral margin of the long head of the triceps brachii. Then we have the shaft of the humerus, and finally the inferior margin of the teres major muscle. The profunda brachii artery and the radial nerve are the contents of the triangular interval. So coming to the floor of the axilla, we have discussed the axillary inlet or the apex, then we have discussed the four sides of the axilla, that is the anterior wall, posterior wall, medial wall and lateral wall, the gateways which are present in the posterior wall, and now we are discussing the floor or the base of the axilla. The floor or the base of the axilla is formed by a fascia. And a dome of skin that spans the distance between the inferior margins of the walls. It is supported by the clavipectoral fascia. Clavipectoral fascia we have discussed in detail in our previous lecture. The contents of the axilla region include muscles, nerves, vessels, and lymphatics. The muscles would be the biceps brachii and the coracobrachialis. Then we have axillary artery, vein, brachial plexus, and the axillary lymph nodes. Biceps brachii. We have two heads of biceps brachii, that is the long head of biceps brachii and the short head of biceps brachii. The long head originates from the supraglenoid tubercle of the scapula, whereas short head originates from the apex of the coracoid process. Both the heads get inserted into the tuberosity of the radius. The nerve supply would be the musculocutaneous nerve. The action of the biceps brachii is a powerful flexor of the forearm at the elbow joint and supinator of the forearm. It is accessory flexor of the arm at the glenohumeral joint. Then we have another muscle which is called as the coracobrachialis muscle. The coracobrachialis muscle originates from the apex of the coracoid process of the scapula, insertion, linear roughening on mid shaft of humerus on the medial side. Nerve supply would be the musculocutaneous nerve. It is the flexor of arm at the glenohumeral joint, and also it adducts the arm. Axillary artery. The subclavian artery, if you see in the picture, this is the subclavian artery. The subclavian artery in the neck becomes the axillary artery at the lateral margin of rib 1. This is the first rib, and at the lateral margin, this is the lateral margin of the rib 1. At the lateral margin of the rib 1, the subclavian artery becomes the axillary artery. It passes through the axilla and finally it becomes the brachial artery at the inferior margin of the teres major muscle. The axillary artery is split into three parts. This is the first part, second part, and the third part. And it is the pectoralis minor muscle which splits the axillary artery into three parts. The first part lies proximal to the pectoralis minor muscle. The second part is posterior to the pectoralis muscle, whereas the third part is distal to the pectoralis minor muscle. Branches of the axillary artery. The first part of the axillary artery, which lies proximal to the pectoralis muscle, pectoralis minor muscle, it gives one branch, that is the superior thoracic artery. The second part gives two branches, the thoracoacromial artery and the lateral thoracic artery. Whereas the third part of the axillary artery, which lies distal to the pectoralis minor, gives three branches, that is the subscapular artery, the anterior circumflex humeral artery, and the posterior circumflex humeral artery. So starting with the superior thoracic artery. This is the superior thoracic artery which originates from the anterior surface of the first part of the axillary artery. This is the axillary artery. The superior thoracic artery originates from the first part of the axillary artery. It supplies upper regions of the medial and anterior axillary walls. Then we have thoracoacromial artery. Thoracoacromial artery originates from the anterior surface of the second part of the axillary artery, just posterior to the medial margin of the pectoralis minor muscle. It curves around the superior margin of the muscle, penetrates the clavipectoral fascia, and immediately divides into four branches: the pectoral, deltoid, clavicular, and acromial branches, which supply the anterior axillary wall and the related regions. Then we have lateral thoracic artery. The lateral thoracic artery, this is the lateral thoracic artery, it arises from the anterior surface of the second part of the axillary artery. It supplies the medial and the anterior walls of the axilla. Then we have subscapular artery. The subscapular artery is the largest branch of the axillary artery, major blood supply to the posterior wall of the axilla. It also contributes to the blood supply of the posterior scapular region. The subscapular artery originates from, this is the subscapular artery which originates from the posterior surface of the third part of the axillary artery. It follows the inferior margin of the subscapularis muscle for a short distance. Then it divides into two terminal branches, the circumflex scapular artery and the thoracodorsal artery. These are the two terminal branches of the subscapular artery, that is the circumflex scapular artery and the thoracodorsal artery. Then we have axillary vein. The axillary vein begins at the lower margin of the teres major muscle. It is the continuation of the basilic vein. It is the continuation of the basilic vein. The axillary vein passes through the axilla, medial and anterior to the axillary artery and becomes the subclavian vein as the vessel crosses the lateral border of the rib 1 at the axillary inlet. Now, two things are important in its course, that it becomes the axillary vein becomes the subclavian vein as it crosses the first rib. Second most important point is that throughout the axilla it lies medial and anterior to the axillary artery. You can see in the picture that the axillary vein is medial and anterior to the axillary artery. Tributaries of the axillary vein generally follow the branches of the axillary artery. Other tributaries include the brachial veins that follow the brachial artery and the cephalic vein. Brachial plexus, a collection of spinal nerves that form the peripheral nerves of the upper limb. We have a separate class for the brachial plexus. Axillary lymph nodes. 20 to 40 bean-shaped axillary lymph nodes are present, which are located in the underarm area. They are responsible for draining lymph. They are arranged into 5 groups, that is the subscapular axillary or the posterior nodes. These are the posterior nodes, the apical nodes, the pectoral nodes, brachial and the central lymph nodes. The subscapular axillary lymph nodes are located on the lower part of the armpit's posterior wall. The apical nodes are present on the upper part of the pectoralis minor. The pectoral nodes are located on the lower part of the pectoralis minor. Brachial nodes relative to the axillary veins medial near the middle and posterior portions, whereas the central axillary lymph nodes are located inside the adipose tissue near the armpit's base. So starting with the clinical thoracic outlet syndrome, the apex of the axillary region is an opening between the clavicle, first rib and the scapula. In this apex, the vessels and nerves may become compressed between the bones. This is called thoracic outlet syndrome. Common causes are trauma, repetitive movements, cervical rib. It often presents with pain in the affected limb, tingling, muscle weakness, and discoloration. Lymph node biopsy. Approximately 75% of lymph from the breast drains into the axillary lymph nodes, so can be biopsied if breast cancer is suspected. If breast cancer is confirmed, the axillary nodes may need to be removed to prevent the cancer spreading. This is known as axillary clearance. During this procedure, the long thoracic nerve may become damaged, resulting in winged scapula. Thank you.